Do you think, and I want to bring up the anxiety, and I'll tell you why, is because 7, 8, 9 years, and I got true rotational vertigo, and it was positional, right? And I was like, man, at this point, I have a pretty strong sense what it is, and I was relieved. As sad as that sounds, I was relieved because I was like, oh, that one makes sense. It wasn't what I had, so somehow it became something that I didn't think I had, but either way, I was like, oh, I think this one's more accepted, right? This one somebody can grab onto and figure out and treat. The rotational vertigo made me a little bit happy. It was an awful feeling. But even in that series of tests, like I didn't want that feeling to happen again. And I kind of knew going into it that I was probably going to have to feel that again. And now for BPPV, that's kind of what I thought I had. It's positional. The tests I saw online, I Googled them, I went on YouTube. They looked easy. Like it would be a normal procedure or process if I were not suffering for this. Like if I was a 10-year-old, 12-year-old person doing cartwheels, I'd be having my head move in different places. I wouldn't be that worried about it. But now all of a sudden that I have the sensation, I'm extra sensitive to any movement, right? And you could be like, oh, move your head left and right and see if your eyes move. You can believe it, I'm guarded. Like I'm not moving my head. I'm moving my whole upper body to absolutely not move my head. But I know I need to challenge myself for these appointments. I know that going in, do you guys ever say, hey, look, or do you guys ever acknowledge, look, you're not going to like me today because I'm going to push you guys into places that I know you don't want to go. Like your body right now is actively resisting because you're scared and your body doesn't know exactly what's going on, but I'm going to do this today. Is that part of the testing process for patients? Like, should we be aware, like, look, buckle up, it might get ugly today?
I don't know if I would present it the exact same way, but yes, some of the tests and some of the treatments, or most of the treatments, kind of require that you experience those symptoms again. Do we want it to be an anxiety-provoking experience? No. So we'll try to do the best that we can to educate you as to why that's important, that it might happen, to what level it should happen for it to be considered more effective, to put you in positions where you feel as safe as possible, and also explaining that anxiety response, I tend to use the term fight or flight response, right? So that I'm not doing any kind of stigmatizing. Some patients don't want to be labeled as being anxious. And it is a physiologic response, and it's normal when you get really dizzy like that. So reinforcing to patients that what you're experiencing is normal and expected. And what we want to do is over time, make that normal expected only happen when it's supposed to happen and not happen all the time.
Yeah. I think one of the big fears I had personally, and maybe others share it, but I felt that even though I knew I was going to have that feeling there, I thought it would stay even after the appointment and you guys would send me packing. And I'd be like, man, I feel better. I don't feel good at all. And I definitely don't feel normal, but I don't want to feel worse when I leave. Mm-hmm. And that's that mental component. And we'll probably talk about next when I talk about conditions here in a second. But man, that idea really stopped me from like making myself available to treatments and even maybe an effective diagnosis. Cause I'm thinking, I really need to trust you, practitioner. Like I really need to know that you've got all the things you need to do today. Because if you get it wrong, and I leave and you're like, all right, well, I'll see you in a couple of weeks. I've got 2 weeks I've got to still deal with, or a month or 6 months to come back and tell you, hey, look, it didn't work, or I'm not sure what to do here. And then either I wait or it gets better, or I've got to go now find a different practitioner and say, hey, look, I just tried this stuff over here. You're the next one up and help me, right? And then it starts over again.
Yeah, I think the only thing we can do as practitioners is be completely open and honest and say, hey, you've got a complex BPPV. I don't think I got it. I don't think I successfully treated it today. You might still have symptoms, right? When you go home, and I'll see you next week and we'll try to fix this again. If I'm open and honest with you, that's the best that I can do to set expectations that, look, I know what I'm looking at. I also know that we may not have had the most effective session today. Hopefully that gets you to buy in and trust the practitioner, is that they're open and honest about that. What you're describing is a very difficult thing for patients to be able to overcome. And it's not always possible for the practitioner to just sit there and be like, stop worrying about it. It's not going to happen again. Right?
Yeah.
So the best thing that you can do as the practitioner is to be honest about that.